Called the MERS virus, that stands for Middle East Respiratory Syndrome. It's a type of coronavirus that causes coughing, fever and pneumonia, and it has scientists stumped. This family in Saudi Arabia lost their father last month after he caught the virus. One of his sons got sick too, but survived. Health officials are trying to work out how and if these outbreaks are connected. So far, all they know is family members are often affected, as are patients in hospitals, where people with the virus go for treatment.
The MERS coronavirus probably originally comes from bats, but that's not how people are getting infected. There must be some other animal species or more than one species that is infected that then transmits the virus to people.
A virus from the same family as MERS triggered the outbreak of severe acute respiratory syndrome, or SARS, in 2003. That started in Asia, but killed almost 800 people around the world. So far, cases of the new virus have been confirmed in Tunisia, Qatar, UAE, France, Germany and the UK. And over the weekend, 3 new cases were confirmed in Italy. Scientists are working to develop a vaccine and also exploring whether antibodies from those who survive the virus could be used to give others immunity.
To treat individual patients, we do have some information that's been published recently from Canadian and American researchers about antiviral drugs that inhibit the virus, at least in the test tube. And so one thing that I've been advocating for is trying to have a consortium of doctors that would offer clinical treatment trials, protocols to patients with this new disease.
The MERS virus is considered dangerous. 60% of those diagnosed so far have died, and the World Health Organization says it's a threat that needs to be taken seriously. But so far it doesn't appear to be spreading as quickly as the virus that caused SARS, and the WHO is urging governments to prepare rather than panic. Tarek Basley, Al Jazeera.
Japan confirms first case of coronavirus infection. Man from Kanagawa had reportedly traveled to Wuhan and was hospitalized with a fever after returning to Japan. Japan has confirmed the first case of infection from the new coronavirus that's been reported in China, the health ministry announced on Thursday. A man in his 30s from Kanagawa prefecture, southwest of Tokyo, tested positive, the ministry said. The man had been to the Chinese city of Wuhan, where there has been an outbreak of pneumonia believed to be caused by the new coronavirus strain, it said. He reportedly returned from China to Japan with the fever and was hospitalized. He was released on Wednesday after the symptoms subsided, according to the health ministry statement. The World Health Organization, WHO, had earlier warned that the new virus could spread and alerted hospitals worldwide. On Monday, a Chinese woman was also ordered quarantined in Thailand after contacting the virus, authorities said. Authorities in Asia have stepped up monitoring at airports ahead of next week's Lunar New Year holiday, when hundreds of thousands of Chinese tourists are expected to travel domestically and abroad. On Wednesday, the U.S. State Department also issued a health alert about travel to the Wuhan region. It referenced the Watch Level 1 alert by the U.S. Centers for Disease Control and Prevention, urging citizens traveling in the region to avoid contact with animals, animal markets or animal products, among other precautions. On Saturday, Chinese authorities announced that a 61-year-old man died from pneumonia, a symptom of the disease, in Wuhan. In total, 41 cases of pneumonia have been reported in China, which preliminary lab tests cited by Chinese state media show could have been caused by a new type of coronavirus. Coronaviruses are a large family of viruses that can lead to infections ranging from the common cold to SARS. Some of the virus types cause less serious disease, while some, like the one that causes MERS, are far more severe. SARS originated in southern China in 2002 and infected more than 8,000 people in 37 countries before it was brought under control. Nearly 800 people died. The possibility of cases being identified in other countries was not unexpected and reinforces why WHO calls for ongoing active monitoring and preparedness in other countries, WHO said in a statement. WHO Director General Tedros Adhanom Ghebreyesus has been consulting international experts on the public health risks of the outbreak to decide whether an emergency meeting is needed, it said.